I'm Tom Lee, editor-in-chief of NEJM Catalyst, and today we are talking with A.L. Glickman, the Chief Medical Officer and Chief Innovation Officer at Sheba Medical Center in Israel, about his country's very effective strategies against COVID in general and through vaccination in particular. One of our goals at NEJM Catalyst is to help people learn from other organizations in other countries. And over the years, I've learned as much from AL as anyone in healthcare. He introduced the concept of proms to me and many other people a decade or more ago, and he's led the development of an extraordinary innovation center in Israel. And he wrote a very nice piece about healthcare in 2030 in NEJM Catalyst recently. But today, we're going to focus on the topic that has dominated the last year, COVID. It hasn't gone perfectly smoothly anywhere, including Israel, but there have been demonstrations and criticisms on a range of topics related to the problems. Nevertheless, the question that we want to focus on today is what went right, because a lot did go right in Israel. What can be learned from and adapted next time around there and in other countries? So, with that long introduction, Al, first, can you tell us just a few sentences about where you work, Sheba Medical Center, and what it felt like as COVID started heading your way last spring?
Sure. Thank you, Tom, for having me. This is a very critical topic. Obviously, we're still very deep in COVID, and even in Israel now, as we're looking at better days that are coming around with the high vaccination rates. Obviously, it's not completely behind us, as we're all still worried about possible strains in the coming future. So, talking about Sheba Medical Center, Sheba is the largest hospital in Israel with just about 2,000 beds. Very strong footprint here in Israel as well, both clinically, but also as a leading academic medical center in terms of clinical trials and innovation, really regarded as an innovation powerhouse on a global scale. And Sheba has also played a leadership role in regards to COVID, really from the very first days, going back to late January 2020. We all remember the Diamond Princess cruise ship with the first patients that came from many different countries. We had a group of Israelis on board. They were flown into the country, and Sheba volunteered to have them and really care for them. Some of them later developed the disease and were cared at Sheba. And later on, Sheba really led in terms of being the first to open a very large facility for ICU patients. And so really a leadership position, I would say, on all levels from the very first days of the pandemic all the way to the vaccinations, which we'll talk about later.
Well, right after the pandemic started getting intense here in the US, in the April-May time period, I remember that you and I had a video call just to catch up, and I asked you, how was it going? And you told me, to my surprise, that it was going pretty well. Now, rockier times did lay ahead, but how did Israel get off to a good start?
Yeah, that's true. I mean, on what we call the first wave in Israel, which happened during March, April, and part of May, we really had a fairly decent time, especially as you compare to other countries. And we all remember those times with a lot of question marks on the virus, on the disease itself, and where everything was heading. I think we were very aggressive very early. We actually caught criticism at the time when we decided to close down the airport, when we started stopping flights from a couple of countries like Italy and later on the US that had higher prevalence of the disease. So being aggressive early on, understanding the gravity of the situation and coming up with decisions that weren't easy on many levels, also on political level, I think was the right thing to do and really got us off to a very good start. That's one thing. Another is, putting our emphasis and focus on protecting the elderly. Obviously understanding that this is where the mortality would come from, the vast majority of the morbidity would be coming from the elderly population. We've put our emphasis to try to protect them, especially when it comes to nursing homes and others, allowing the nursing homes to continue to operate without having to bring in new people who might be carrying the virus, or having some of the elderly walk outside. So that was a focus that was part of the strategy right from the get-go. I think it served us quite well. And then finally, the third point would be the high testing capacity that we got very early in the game. I think many countries later caught up, but just like with vaccination, with testing, we were able to acquire a large amount of testing kits, open testing centers across the country, and all the way, already in March and early April, get to very high levels of testing for the population, which of course we know today is critical.
In that early phase, I know we all felt jealous of Israel's effectiveness in really taking care of the elderly, really getting testing done well. Um, but it must have been a surprise for you when things did get bumpy in the fall and then in the winter in Israel, like everywhere else. What were the big factors that led to those surges, and then how did Israel respond?
You're absolutely right. Come fall and winter, especially later in September after the Jewish high holidays, it became more turbulent in that regard. A couple of things that, reflecting back, I would say, one is, I think we opened schools too early. Schools in Israel are much more crowded than schools in the US or Europe. We typically have classrooms with 30 plus, all the way up to 40 kids in a classroom. So, opening up schools early on, in early September, I think was one of the things that really caused us to spike after having a very decent summer with very low rates of the virus. We have culture in Israel is always complicated. You're talking on one end on, Orthodox Jews, on the other end on, people in Tel Aviv that are very modern, and you have an Arab population in Israel, and the cultures are very, very different. And how do you work with the different cultures? How do you make sure everybody understands the importance of how we act and how we react? That has been also a challenge that I think came through, especially during that time. And we were able, I think, with the high rates at the time, we were able to still keep a very low case fatality rate, which I don't think was really talked about that much. If you compare the US to Israel, case fatality in the US was about 1.8% overall from the start of the pandemic. In Israel, it's 0.8, so less than half of the case fatality in the US. And I think one of the things that we did do during this time, we were able to increase hospital capacity very quickly to 3-4 times the capacity that we have in normal times in terms of ICU beds. And that's remarkable because we're always worried and concerned about low ICU bed rates in the country. And obviously this would be very much critical in times of a pandemic. But the ability to react very quickly and really expand the hospital capacity, especially in intensive care units, really came to our advantage, and was really we were really able to keep the low case fatality rates with the response of the hospitals. And of course, Sheba played a major role with that. Imagine we opened an ICU with 100 beds in one of our underground parking lots. It took us about 48 hours to do that, and I think that's part of the reasons why we kept a very low case fatality rate.
Well, this is really a great story. This is like an adaptation of a high reliability culture that many hospitals have developed in their efforts to improve safety, extending to a country. You implement certain things, you make progress, but then new issues arise, new opportunities to improve arise, new imperatives arise, and you learn and you respond and adapt quickly. So it's really a great story in many ways, and that's what we want to feature um, in NEJM Catalyst. But then the next chapters, the vaccines arrive, and Israel was basically 10 times faster than the US and most other countries in getting its first 20 to 30% of citizens vaccinated. I know you're much smaller, but that doesn't mean that we can't learn from what made Israel so effective. So, why did it go so well in Israel?
Well, it's a great question that we're obviously we're asking ourselves and we're being asked. And I could probably name four factors that play a role here. Maybe the most critical one is the healthcare structure in Israel. The fact that everyone is covered. We have four HMOs that cover, from an insurance point of view, but also provide primary care to 100% of residents in the country. And those four HMOs are used to doing things exactly like this. They're used to having these mass campaigns, whether it's for vaccinations or for other reasons. They're really built into the community, which is something that is very much unique in Israel. You cannot go down five or 3 blocks of streets without seeing, at least one clinic for one of those HMOs. They're really built very deeply with roots into the community, and that came in very, very helpful. So that's the first reason. The second is also related to that, and that is electronic healthcare data. Israel is one of the only countries in the world that has a very, very effective information exchange system that covers 100% of providers, 100% of residents in the country. And that allowed us very easily to, first of all, set prioritization on who needs to get vaccinated first and implement it very quickly. So imagine, people were getting a text message saying, why don't you come tomorrow to this and that address at 10 a.m. and you'll get vaccinated. And if you can't make it at that time, call this and that number and suggest a different time. And we're able to do that through the prioritization that were set according to age, comorbidities, and so on, and then very, very quickly get the data on where we are at any point in time exactly. And I think, again, that came in very handy to set this up. The third is supply chain and distribution, especially with the Pfizer vaccines, the need to keep them on -60, -70 degrees. We were able, obviously Israel is a small country, but we were very, very effective in terms of the supply chain, bringing it to only 2 points in the country that were housing and storing in -70 degrees. And then from there, distributing it to the four HMOs, plus a few of the very large hospitals like Sheba Medical Center, who were working really around the clock to vaccinate. And, we've got to about 90% of population over 60 in a matter of 3 weeks, which is really incredible. And last, and really connected to all of that, is setting a sense of urgency, which is something I have not seen in other countries, especially during the initial days. It was evident to us here in the country of Israel that what's going to get us out are the vaccines, period. There's nothing else. And so once we've set our minds to focusing on vaccinations, getting the data and getting the high vaccination rates as soon as possible, everything was put behind that. Nothing else got higher priorities. And again, that sense of urgency maybe comes from our, the fact that we're used to times of emergency. We know how to mobilize behind the cause. I think this came in handy in this situation as well.
Now, I know that second guessing is not completely new in Israeli culture. So I'm expecting you'll have something to say when I ask, if you knew a year ago what you know now, what could Israel have done better?
Well, it's a great question. We're reflecting on that. We'll keep on reflecting on it for the months and years to come, hoping we won't have to deal with this again, but knowing that, we probably would at some point. I think it's the little things that we need to do better. We've done a lot of good stuff. We mentioned a couple of them, that obviously the vaccinations, but also the testing and, the capacity around the hospitals and so on. But the little things like waiting with opening schools, I mentioned that before, back in September, especially in areas with high disease prevalence. We weren't good enough with differential restrictions. Some cities needed to go into lockdowns, while others could continue daily life. We weren't able to handle that. Many political reasons for that. We're relaxing some restrictions too soon, like restrictions in travel. We could shut down the airport in March of 2020, But in the summer, Israelis were anxious to go out and for tourism purposes, and we opened the airports, and sure enough, some of the variants came in during the time. So it's a lot of those simple things that I think next time around we need to be much better at handling those decision making. And lastly, maybe a better enforcement of restrictions. It's not enough to put forward restrictions. You have to have a good system of enforcement. And again, in Israel, we didn't do enough of that. That could have probably served us well, especially during the winter time.
Well, and one of the issues that's gotten some press attention is while the rollout of vaccination was very effective for Israeli citizens, it was much slower for Palestinians, that they were not included. I know there must be discussion of this issue in Israel. Can you give us a flavor of what those discussions are like and how the issue is being addressed?
Right, it is an issue, and of course discussions are in place, and some decisions were made. For example, a decision that Palestinians that are working in Israel would get vaccinated, and actually Sheba Medical Center took the lead on that as well in terms of positioning vaccination stations along the border and vaccinating tens of thousands of Palestinians within a very short while. So some actions are taken. We've also played a major role in treating some Palestinians who had severe disease and needed higher levels of care, more more experienced teams, and some were brought into Israel and into Sheba as well to treat some of them as well. But obviously, much more needs to be done. And looking into the future, I think now that we're at a situation where in Israel things are looking very well. We definitely need to see where we can help more with our neighbors, and obviously we definitely need to be more active on that.
Well, thanks so much, Eyal. I know that our listeners will learn much in the years ahead from Israel and other countries' work, and especially from you and your work.
Thank you very much, Tom.